Right, my name's Dave Ashton.
Yeah.
I'm 69.
Yeah.
I've smoked all my life since I was 18 up to 3 years ago. 3 years ago I got COPD. Didn't realise I'd never realised I had COPD. It hit me very hard, put me into hospital. I decided there and then that definitely wasn't for me, hospital beds. So I never had another smoke when I came out. Never had another smoke. But I was bad, and I was having a district nurse and this, that and the other. And eventually they put me in touch with the COPD clinic in Stockport. And I went there, and I think it was an 8-week course. And within that 8 weeks, I just couldn't believe, because I'd gone from what I was, I'd gone to actually running on a treadmill. Running, not walking, running. This was only 2 years ago. It's surprisingly, it was only 2 years ago. So we keep in touch a lot on Alvanley site. We have done that right away from the beginning, because it's a brilliant site to be on. And this came up, and I said to the wife, I said, we'll go on that, we'll give that a try. So we went on it, and I never dreamed, quite honestly, I never dreamed that she would put me on this hill straight away. And we turned this corner, and there's this hill that, I don't know, it was just seemed mammoth to me, because I'd avoided hills at all cost. And she said to me, well, look, just take your time, do it in your own time, you will get up. I didn't believe her. But I did get up with a lot of huffing and puffing, believe you me, there was a lot of huffing and puffing, but I was with a lot of ladies. And being a man with a lot of ladies, you don't give in like that, do you? So it pushed me up, and I did get up. And this week, I've done it again this week, and I've gone faster than I've ever gone up that hill. I didn't even ever stop halfway up, went all the way up. But as a lad, I worked at Lyme Park, and my favourite part at Lyme Park used to be Scouts Camp. And it's right up on the top of a hill, right up on the top. You can see the whole of Manchester and watch the planes landing in and out of the airport. And I never ever dreamed that I would ever get up that hill again. But we did it, and I just couldn't believe that I did get to the top of that hill. That was, I'm not going to say I didn't stop, because I did stop. And you get to a point on the hill where you either go up or you come down, and it's further downwards that way than it's up that way, so it was better to go up. So we finished up getting up, and that hill was like something that I wanted to do, but I never thought to be able to do it again. And I'd done it, and that's why I think now this walking business is so important, particularly for people with COPD. It's not a nice illness. I'm not going to say it is. It's not a nice illness, and there's no getting better from it. It's just steadily worse and worse and worse. But with the right attitude and with the right way of going about it, which with going to these meetings, you learn how to have that right attitude. You learn how to control a panic. And panic is horrible, but you do learn how to sit back and say, no, it's not going to beat me. And you don't let it beat you.
Excellent. What was it about the practice, Alvanley practice, that made you want to go on the walk?
I support it so much because they've been so good to me. They've been brilliant to me. And they always have the patience. It's not, you don't come here and nobody knows your name. You come here and everybody knows your name. which is very surprising for a doctor's surgery. And it's not just me, because they know everybody's name.
Yeah.
And they really take that extra time on you, and they really find out about you, and it's, well, they can read you. They can read you, and they could read that I was anxious.
Yeah, yeah.
They really could read that I was anxious, and that's why they sent me on those things. And that's why I think I came on the walking dude, because it was part of to do with Alvanley, and partly because I needed to do it for myself. I really did need to. There's nothing I like better than walking.
Yeah.
But I was getting that way where you can't be bothered. You can't be bothered, so you just sit back and you do nothing. But hey ho, without that, we don't go back to that.
Yeah. And do you go on the walks a lot? Do you go on it every week or?
Yes, I go on it every week, and we try and walk every day because we have a dog.
Yeah.
So we try and walk the dog round a countryside every day. So that's very nice. We enjoy it. Yeah, we enjoy it. And it gets us out.
Yeah. What would you say to other people who are a bit nervous about coming for the walk, who weren't as motivated as you?
Come, because you are made to feel at home. You're not made to feel an outcast. You're made to feel part of it straight away. I wouldn't even think twice if it was me, and I advise people, don't sit back and do nothing. Get out there. Get out there. Come join us on those walks. That way you make friends. And not only do you make friends, you learn a lot from other people, what they're doing and how they're going about their life. And you can actually advise them on what to do, where to apply, where to go, and this that, because you've done it yourself. And I don't know, I just think it's a very, very good thing. I really do.
Excellent.
My own personal experience is that I had a very stressful job with NHS England and decided that for me personally I needed to change my lifestyle, and one of the criteria for me about changing my lifestyle was that I needed to be able to walk to work, because I knew that I needed to get some more exercise and have something to mark my day, and the thing that marks my day is a walk. So when I heard about the Walking for Health scheme, I wanted to bring that into the practice because I knew it made a huge difference for me. And talking to the partners here, we thought that it would make a difference to our patients. So we approached the Walking for Health scheme, and we were fortunate enough to be able to offer something for our patients here. So we have a Wednesday wander. We leave here at 12 o'clock. Patients come 10 minutes before and we'll have a chat in the waiting room. Patients of any abilities can come along and we just walk for 30 minutes. And we cover a mile in those 30 minutes, and it's about 2,000 steps.
Yeah.
And we end up at a cafe so that the people who've taken part in it can sit and have a coffee and a chat. And as David rightly says, that we have that opportunity then to share experience with other people.
We do,
David was really kind to another gentleman that came along whose wife had cancer, and David and his wife could give advice about the treatment and what to expect and where to go for help. So without us as a practice having any kind of intervention or signposting, our patients, by getting together, supported each other, and that's priceless.
Brilliant.
So David talks about our website. It's not actually our practice website because we felt that meant our patients had to make a certain amount of effort to come and find us. So we now have a presence on Facebook, which means that it's more interactive. They can like us and then see information on their feed. And David and his wife were the best supporters of us on that. They would comment on every post we had and they would share information. And it breaks down lots of barriers. They might see a picture on our Facebook page of one of the doctors on their birthday, and we'll be celebrating that. Or it might be that we're advertising for our walk or talking about breast cancer or whatever it is that's in the news at that time. So we find that Facebook is a really good medium for communicating with our patients.
And what do you think GP practice's role is around health and well-being?
Well, I think it's growing. we can't afford to pay for all the medication. We can't afford to keep up with demand from our patients. Unfortunately, you know, we have 4,700 patients, and if we gave them everything that they wanted or thought they needed, we would have nothing left.
Yeah.
So in order for us to provide for all of them, we need to look outside of the practice and at other things that we can do. So that's where the walking came from, and also we're now looking at something around food and health. So we're looking at developing something within the local community about how we can perhaps grow things closer to the practice and get our patients involved in that and building the community around us.